The impact of COVID on health is evident at so many different levels. There is the direct effect of the virus directly on health, and then there is the way that the various measures that are having to be taken in order to protect people from the virus are impacting on factors like employment, like education, which in turn indirectly affect people's health. The pandemic is intensifying and amplifying existing areas of inequalities.
COVID-19 is a massive external shock to the social system. External shocks expose the underlying inequalities in society and amplify them. We published a report with the support of the Health Foundation in February 2020, showing that the slowdown in improvement in life expectancy in the UK was more marked than in any other rich country except Iceland and the United States. And then the pandemic happened, and the Office for National Statistics looked at excess mortality. And the excess mortality in England was higher than in Scotland and other parts of the UK, and higher than in any other European country. And the effect of COVID-19 on society is so massive. Huge economic downturn, exaggeration of inequalities, that this review that the Health Foundation is conducting is of the utmost importance. And that's why I'm happy to support it.
One of the striking things that has emerged from the coronavirus pandemic is how it has impacted differentially on different segments of the population, how it has reinforced existing health inequalities and the appearance of those existing health inequalities. People living in poorer areas have a much higher risk than people living in richer areas. This is almost certainly a result of individual differences in socioeconomic fortunes. And ethnic minority people, of course, this most striking finding that we've seen is that ethnic minority people are at much greater risk of mortality from COVID-19 than the majority population.
It's vital to consider the wider determinants of health when we think about the coronavirus pandemic, because this wasn't just a health crisis. It was also an economic crisis and a social crisis. It had effects on every single part of our lives. Surely we can make this an opportunity for change.
We need to tailor our responses to the coronavirus pandemic in order to ensure that they do not amplify and rather reduce inequalities. It's crucially important that we have an inquiry that focuses on the question of inequality in relation to COVID-19, an inquiry that looks at health inequalities, both in the immediate context of COVID-19, but also in the longer term. So how the responses to COVID-19 may be amplifying health inequalities, and at the same time looks at those fundamental drivers that are producing these health inequalities, both in relation to COVID-19 and in relation to the consequences of COVID-19.
I think the results of this inquiry will enable us to try and make this a turning point for health inequality.
What this inquiry does that I think can add value to all of that other work, we are going to try and understand the different pieces of work that are going on, to join them up, to connect them, to be able to see the bigger picture, to extract some really important themes, and to provide a solid evidence base that people can draw on in starting to answer these questions, both about what the short and medium term recovery policies should be, and also understand over the longer term how we can improve people's health and tackle some of these very, very big issues of inequality,